Most practice owners think, well, if you have teeth, I want to be your dentist. And it's like, it doesn't really work that way. We're starting to see movement into these different, very niched and very curated types of dentistry models. And so, yes, I think it's critical to look at, are we just missing this patient because they're not in alignment? Or in more extreme cases, should we be dismissing this patient because they're disrespectful to the team? Should we be dismissing this patient because they are now expecting us to deliver substandard care to align with what their wants are?
Hello, friends. My name is David Rice. I'm your chief editor here at Dentistry IQ, and I'm back again for Gloves Off with my buddy, Katrina Sanders. How are you?
Hey, Dr. Rice, I'm so good. How are you today?
I'm feeling feisty, so I'm really excited for our topic today. This is a big one. I know a lot of dental practices go through. I dare say every dental practice knows it, but so few probably do it. So I'm excited to tackle this. Do some of your patients need to be dismissed?
Oh my goodness. Okay. I like it. Let's start really provocative right out the gate, shall we? Yes, you do have patients in your practice that need to be dismissed. And I think, part of the challenge in dentistry for so long is we were not niching or branding or understanding within our specific practice, what is our ideal patient? What does that ideal, individual look like walking in and out of our doors? Because depending on what type of a practice you are in, somebody who is a patient that wants more holistic conversations or wants to talk about high-end cosmetic procedures, that patient is not going to be an amazing patient. If you have the type of practice where you're moving people a bit faster, maybe your hygienists are doing a double column hygiene situation. So we really need to look at the target patient. Does our practice align with the type of patient that's walking in and out of our doors? Is this a patient that requires more TLC and attention, and we just don't have that model within our practice? And so I think there's been a critical component of that dentistry hasn't looked at, because I think most practice owners think, well, if you have teeth, I want to be your dentist. And it's like, it doesn't really work that way. We're starting to see movement into these different, very niched and very curated types of dentistry models. And so, yes, I think it's critical to look at, are we just missing this patient because they're not in alignment? Or in more extreme cases, should we be dismissing this patient because they're disrespectful to the team? Should we be dismissing this patient because they are now expecting us to deliver substandard care to align with what their wants are? In which, perhaps the answer is, that's not the level of care that we deliver here, but we'd be happy to refer you to somebody who will provide substandard care illegally and supervised neglect for you. And so I think the important piece here becomes, we really have an opportunity to look at, what are our core values? What are our practice values? And do we have a clientele that aligns with that?
I love that. And I think one of my favorite things about you, Katrina, is you have a very easy way, almost disarming way to have honest conversations with people. And I think most of us in life, we shy away from that honesty because we're afraid of not being liked or someone's going to be upset with us.
Yeah.
It doesn't have to be that way though, does it?
Well, and that's exactly it. I think the first important component to having these types of really courageous conversations with our patients is letting them know that you're doing this out of the best interest of their health and their needs. Because we do know there's a spectrum of how people value healthcare, how people value particularly their oral health. And yes, there is an entire population that wants the best of the best. They want salivary diagnostic testing. They want to know the concentration of C-reactive proteins coursing through their system. They want to talk to you about nutritional panels and things like that. And yet there are patients that don't value that. And so I think, to your point, having that courageous conversation really begins with, what are your goals, patient? What is it that you want? And if that's not something that we're in alignment with, our responsibility should be to find them that resource or to be able to find that supportive element. But what's the opposite? The opposite is you continue to remain a patient of our practice for forever. And we constantly are butting heads. And then every time we talk about you in the morning huddle, when you're coming in, we're like, oh, here we go. David's coming in today. All right, well, here we, and that's not fair either for the patient. And so it really comes down to, yes, dentistry, we really work to be likable. We want to, we want, that's why we didn't get into, healthcare where we have to tell people they're dying. We want to make people smile as a part of why we all went into dentistry. But the idea being, likability aside, we are healthcare professionals, and it is our responsibility to our patients to ensure that we're delivering the right layer of care for them.
So what's your process for that? If I'm a practice out and I'm watching right now, I'm thinking like, oh, I so need this conversation, but I don't know what to do first.
Yeah. So I think the first thing, particularly if you're a practice owner, is to remember that you have an entire team behind you. And I'll tell you, if you're thinking that maybe you need to dismiss a particular patient from the practice, and you mention it to the hygienist who's been seeing this patient for years, or the front office team member who's been arguing with that patient every time they come in, if you bring that up and ask your trusted team members, what do you think about this patient? Do you think that they are in alignment with the type of practice that we have? Your team will absolutely give you the yes or no that you're looking for to help provide some verification. But that really begins with you as a team identifying what your target or ideal patient base or clientele looks like. Because if you don't know who you're serving, it's really hard to reflect or compare against that. We know that a 1, 2, or 3 millimeter pocket is going to be acceptable in perio. That's what we know because that's what we want. And then we know anything that's outside of that is going to be an area of concern. So we have to be able to identify, not only looking at our team members to help support us in that, but also identifying what does our ideal clientele look like? And then moving forward, how do we have that conversation with that individual where we help them understand that this is not anything personal? It's simply, we can't serve you to the best of your abilities. And I do believe that really kind verbiage, things like, I hear you, David. I understand that this is the level of care that you're looking for. Might I suggest that we send you to somebody who's, more better equipped or armed to be able to deliver that level of care for you? And again, it doesn't have to be, I'm officially dismissing you from the practice. You're a pain in the tuchus patient. It should really be about, I want to get you the help. I want to get you the care that you need. And that's not something that we do here. That could be something as simple as the patient who wants that pro-fee, that free cleaning their insurance covers, right? And yet you keep telling this patient they need periodontal treatment. At a certain point, you do have the option to say, that is not a service that we provide here, but we'd be happy to give you some resources of some local practices that may be able to help you with that.
Yeah, I love that so much.
The idea being, if the patient argues with you about it, it's kind of like, when you're dating somebody and then you break up with them and then they go, and I've been cheating on you. And you're like, wow, well, that made it really easy. Now I don't feel bad at all about, so the idea being, if the patient gets upset, you've already dismissed them from the practice. Like that puts the nail in the coffin and really helps. And the idea being, when you get rid of, or when you remove those patients that are draining on your team, that are making the days more difficult for you as a clinician, you open up the door to focus on the amazing patients in your practice, the ones that do appreciate you, the ones that are going to refer their family, their friends, people in their congregation, whatever that may be. And so really, the more that you become focused on that ideal clientele, the more that you're going to be able to do the kind of dentistry that you love.
Yay. So friends, Katrina, first of all, thanks for joining us here today, friends. Thanks for watching. We can't be all things to all people. Figure out who your top 20% patient is, who you ideally want to be working with, and how. And until next time, gang, we're going to put the gloves back on. We're going to kind of act like civilized people, but we'll see you soon.